The absolute contraindications for hyperbaric oxygen therapy are attention pneumothorax, obviously due to the trapped gas that's present, as well as a bronchospasm, and a non-compliant tympanic membrane. If that tympanic membrane, until such time as that tympanic membrane can be forced to comply or made to comply via a drug. Some relative contraindications are a pneumothorax, as seems evident, upper respiratory tract infections, some viral infections, as well as high fevers. High fevers are going to increase your likelihood of central nervous system oxygen toxicity, and that obviously is a non-starter. Emphysema with CO2 retention, obviously not a good indication, certainly a contraindication. Cisplatin, and that's if they're on cisplatin right now. If they had cisplatin up to 6 months ago, that's okay. 6 months or greater, cisplatinum's okay. It's just not having been on it right now. Optic neuritis and a history of middle ear surgery or middle ear dysfunction. This goes back to the tympanic membrane that we had, and it's just something that on an H&P, you want to rule that out. You want to rule out that they've had a history of middle ear disorders. A history of seizures only because we don't know where the seizure is coming from. For instance, if it's an epileptic seizure, you don't know whether it's an epileptic seizure or central nervous system oxygen toxicity seizures. So, and obviously pregnancy is a relative contraindication because it's a passing state, if you will. So let's go into the pharmacokinetics a little bit. Typically the oxygen is dosed by liters per minute. It is a drug regulated by the FDA. In hyperbarics, we dose it with depth and time. So greater depth and longer duration periods of time, that'll give us our dose for hyperbarics. It is a respiration drug. In other words, you inhale it, it goes down through the alveoli into the bloodstream, and you inspire it. It is irrelevant whether or not you're surrounded by the oxygen. So there are some people that are trying to force oxygen into a wound. Healing doesn't occur that way. Healing occurs from the inside out, not from the outside in. So, like I said, the alveolar diffusion certainly takes place, and the Henry's law, you transport that plasma to the tissues that it needs to get to. The interesting thing about hyperbarics is that the plasma will actually start to transport oxygen, where normally hemoglobin transports oxygen, red blood cells will transport the oxygen, but in a hyperbaric condition, plasma can get oxygen to the cells, and plasma on a relative scale is significantly smaller. So it can get further down the run a little bit. Some of the pharmacodynamics, some of the desired effects, right? What we're looking for is hyperoxygenation. We're looking for hyperoxygenation of the cells to stimulate all the things that we talked about earlier, the collagen. And we're also looking for, in some cases, antibiotic synergy, because that's a really good effect to have, and we can certainly help out the antibiotics. Some of the adverse effects, central nervous system oxygen toxicity. Obviously, that's our big one, and most important on that list is convulsions. So the list of convulsions, that tonic-clonic sort of a seizure, obviously not a good thing, especially when you're trapped inside an environment like a chamber. Visual disturbances, and these visual disturbances will be black dots, and what I've seen is people reach up off the bed and kind of go like that, waving their hand at nothing. So they're seeing a black dot, and you see them visually like try and move it. Visual disturbances, nausea, twitching, tingling, tingling in the extremities generally, the twitching, I've seen it in the facial muscles, irritability and dizziness. And I've seen some people just take their leg and wrap it around the bottom of the gurney to try and hold themselves on. So you're thinking, why are they doing that? Well, they're just a little dizzy. So sometimes you gotta ask a couple of questions. Other adverse effect, pulmonary oxygen toxicity due to the cumulative effect of oxygen, and this would be substernal irritation, pain on inspiration, reduced vital capacity, and the first thing that I've seen, bar none, it's a dry, scratchy cough. So if they're getting to that point, it's time to take them off oxygen.